and the recording of this session, okay?
Okay, so I can still, because this is mostly verbal too, right? So audio,
Right.
so I can listen. Okay.
Right.
Because the screen didn't come up.
Okay. All right. Okay. I have her email. So Linda, I'm going to go ahead and send you the presentation right now, so you have it, okay, as we speak.
Okay.
Okay. All right. Well, everyone, please mute your line once again for me. Thank you so much for joining us for the TCC Shark Tank webinar. I'm going to hand it over to my colleague, Dr. Hopkins, to begin the presentation. Once again, if you have any questions, go ahead and just add it in the chat box or just wait till the very end of the presentations and we'll be taking your questions there. Okay.
All right, hello everyone. Thank you so much for joining us for this Shark Tank webinar. What we're hoping to accomplish today is to give you an overview of this Shark Tank mechanism. This is actually a new mechanism for us, and I'll explain a little bit of the background behind this mechanism. We want to share some vital information for you as you are preparing. We're hoping that you are preparing to submit concept papers for this mechanism, and also to answer some of your questions. Especially in the relatively tight timeline that we have to work in to facilitate the Shark Tank competition and subsequent proposal development activities. So our official statement, just so everyone knows, we are funded by the National Institute on Minority Health and Health Disparities through a U54 cooperative agreement. The contents of this presentation and what I say are solely the responsibility of the authors and investigators, not necessarily represent the official views of NIMHD or NIH. So just a quick overview. I'm hoping that I can get through this presentation in about half an hour or less to provide some ample time for questions and answers. So we're going to talk briefly about our TCC for those of you that may not be well versed in what we do. We're going to talk about our pilot project program. Pilot project program is the umbrella under which Shark Tank resides. We're going to have a pretty detailed overview of the Shark Tank, eligibility, the concept paper submission, and the actual competition and next steps. And then we're going to give you a few tips to writing a competitive concept paper, and we'll end with a question and answer period. One thing I'll add, just as a quick housekeeping note, I know that Dr. Ofebu mentioned it, but if you have any kind of burning questions as I'm going through the presentation, by all means make full use of the chat function. I'll do what I can to loop in answers to those questions as I'm going through. Otherwise, we'll use those questions for the question and answer. Okay? All right. Before we go ahead and get started, I just want to make sure that everybody is still with me. So if you can still hear me, what I need you to do is go ahead and send a "I can hear you" or "Hey, I'm here," some type of function or some type of message in the chat box. Wonderful. Thanks, Felicia.
Andre Moore is here.
Wonderful. Thank you, Mike. Thank you, Micah or Mika. Okay. We're going to go ahead and move forward. If there are any connectivity issues as we move along, just go ahead and let us know. Micah, thank you. Thank you for the verification. I appreciate that. I'm really big about names. All right, so we're going to go ahead and move forward. So this is going to be our TCC overview. So our TCC is really focused on informing health policy and practice with evidence-based science. So throughout this presentation, we're going to come back to that phrase. And I'm hoping that you all kind of have a very strong understanding of what that means and how we operationalize that in our work. So policy change is, of course, essential to having health equity. So our TCC, our partners, our collaborations are all driven by this goal of achieving health equity. And what we mean by health equity is not the same as equality. We understand that not everybody is at the same point when it comes to resources and opportunities. To achieve health equity, you really meet people where they are. You give them what they need, when they need it, and then an amount that they need it to maximize their health potential. So as operationalized by our leader, Dr. David Satcher, every person deserves the opportunity to reach his or her maximum health potential. So in achieving health equity, we're setting the conditions necessary for all persons, regardless of any types of circumstances, whether it be sociocultural, economic, or even health status-wise, has that opportunity to maximize their health potential. So as we dig into how policy can be utilized to achieve health equity, there are several different dilemmas that we found over the course of the time that we've been doing our TCC work and some of our prior activities where there are dilemmas. So the typical policy dilemmas that we encounter are there may not be a policy that exists to support a certain condition or to support resources that can be used to set conditions. The policy may not be effectively implemented, meaning that the intention of the policy is not operationalized in its action, or there may be a policy in place and is actively being implemented, but the results of that policy are yielding unexpected or deleterious consequences. So for example, if you have a policy in place that provides healthcare to a certain population, but that healthcare is contingent on access, those individuals that have access barriers may not be able to fully benefit from that policy. So that we will consider that a policy dilemma that we want to critically explore and come up with solutions to help address within our TCC. So our burning question or our big picture question as a TCC is, what strategic approach is needed to inform policy towards the advancement of health equity and the elimination of health disparities? How do we identify where those policy dilemmas are, and how can we be a part of the process of addressing those policy dilemmas? So a little background on our TCC. As I said earlier, we are a cooperative agreement with National Institutes on Minority Health and Health Disparities. We are currently in year 4 of 5 of our TCC funding cycle. We consider ourselves an institution-wide center without walls. Our principal investigator is Dr. David Satcher, who is housed within Satcher Health Leadership. However, we have investigators, research personnel across all different centers and institutes here at Morehouse School of Medicine. And the partners, our research partners, our external partners, are very vast and very diverse. At this point, we are actively collaborating with about 75 organizations across 17 states. And our unifying theme for the TCC is to develop and implement a comprehensive and meaningful approach to the development, advancement, and implementation of health policy that harnesses the power of collaboration to bolster innovation, cost reduction, and health equity. So in terms of our catchment area for the TCC, our research and our outreach activities are focused in on what is considered HHS Region 4, which is colloquially the Southeast United States. So an additional group that we also, group of states that we also do work with are the Red Eye states, which are Maryland, Minnesota, Missouri, Oregon, and Texas. And just an operational definition, Red Eye Coalition stands for Racial and Ethnic Health Disparity Actions Institute Coalition. Okay, we're going to talk a bit about our strategic approach as a TCC. We employ a health equity lens to all of the work that we do. And what that means is we're taking a look at different policies throughout the policy change process when it comes to policy development, policy adoption, policy implementation, evaluation, and then going back to policy change and or development. So we think of policy as going in that perpetual cycle. The one question that we ask, or the lens that we employ, involves asking the question, does the policy ensure that all individuals may derive the maximum benefit from the policy provisions? After we ask that large question, then we ask, are there any vulnerable populations adversely impacted by those policies or adversely impacted by policies not being in place? So That is a quick description of what we consider our health equity lens. The second form of our strategic approach is thoughtful collaborations and collective impact. How can we effectively collaborate with a number of different stakeholders that are at the grassroots, that are within systems, or that are in more broader-based areas to do innovative research and disseminate findings to key stakeholders. And the last aspect of our strategic approach is informing policy at multiple levels using evidence-based science. So the understanding is that policy change and policy impact can happen not just at the broad federal, state, local level, but there are systems level policies and there are more individual and family community-based policies that are just as important to impact if we want to see health equity change. So to dig a little bit further into some of these anticipated policy impacts, this is a conceptual model that we use to help explain what we mean by policy impacts across different dimensions or different levels. So you have downstream impacts that really focus in on individual group knowledge, behavior, and increased capacity to be a part of the policy change process. And we mean by that to inform policy change. We also have systems-based policy impacts, so hospital systems, provision of care systems, even community systems, school systems, and the like. And then you have your community and or population level impact. So specific laws, regulations, and other provisions that can impact entire populations. So we see potential for our work to impact policy across all of those domains. So our primary research focus areas, so our TCC is grounded in 4 research sub-projects. So the topic areas within those sub-projects are quality parenting and child development, the integration of mental and behavioral health into primary care. So we're looking at a culturally centered model of integrating mental and behavioral health into primary care within the Grady Health System here in Atlanta. We're also focusing in on health information technology to reduce disparities. So how different populations and different providers utilize health information technology. And then health policy leadership needs and impact. So what are the essential components of developing policy leaders that are focused in on advancing health equity? And what impact will those leaders have on actually advancing health equity once they've gone through training? Another aspect of our TCC that's very important is creating a platform for individuals to convene and to really dig into some of these health equity topics. And we facilitate those conversations and those interactions through our quarterly Health Policy to Practice Forum series. So once a quarter, we have a health policy topic that has caught some traction nationally. And we try to really convene a set of diverse stakeholders to really dig in and have some great conversation and to also share and network during that event. Our TCC Health Policy Research Summit is an example of one of those types of forums, which is serving as our kind of culminative convening activity for this year. We also strive to bring policy discourse into diverse settings. So there are a number of individuals in a number of different organizations that are doing some great work addressing health equity in a number of different domains, whether it's addressing the social determinants of health, taking a critical eye at the policy translation process. You know, the list goes on and on, you know, folks that are centrally focused in healthcare settings. Our goal is to bring that policy lens or that policy perspective to these different settings. Now I want to talk a bit about our pilot project program. So the goal of our pilot project program is to support pilot research projects that are aligned with our overarching goal, which is to critically examine and address some of these health policy issues that are relevant to the advancement of health equity and elimination of health disparities. So this arm of our TCC is really an opportunity to explore and expand upon new partnerships that are consistent with our 4 core health policy focus areas, but that are also diverse in other important in other pertinent health policy areas. So if you will, this is really, our pilot project program is really our laboratory or our space to really expand upon this health policy research enterprise that we're trying to develop. So who is eligible for the pilot project program? It's open to both faculty, investigators that are tied to academic institutions as well as non-academic organizations. The pilot project program grantees, in terms of who we work with, it's consistent with our catchment area being HHS Region 4 as well as the CDC Red Eye states. So just a quick overview of some of our pilot project funding mechanisms. So our implementation awards are a max value of $50,000. That's direct and indirect. That is for the full implementation of a pilot project. Our developmental seed award mechanism was developed to work with partners in helping them garner the expertise and the formative activities necessary to conceive a fully fleshed out pilot project. So that's a smaller award. It's about $10,000 direct and indirect. And then for our current grantees that have done great work, that have demonstrated favorable outcomes that wish to have additional funding, we do have a pilot project renewal mechanism. Our primary goal essentially, though, is to start off with one of the awards and then to develop the grantee and develop the project to a point where they can obtain extramural funding. So the work that we do in informing policy and practice with evidence-based science. So we kind of break that down into three different components. So it's generating the knowledge through research, through data collection, analysis of different data, whether it's primary data collection or secondary data collection if you're looking at population level data sources, or if data has been collected within a system previously, taking a critical policy lens analysis of a particular research question. That will be under generating the evidence. The next piece that we are interested in and what we do support is translating the evidence. So translating the knowledge, the evidence into meaningful information for multiple stakeholders. The last area of focus for our TCC through our pilot project mechanism is dissemination. So once the information has been packaged and translated appropriately, disseminating that information to diverse audiences that are associated with the policy impact process. Okay? I just want to be very clear that that's really the environment and that's really the universe that we occupy as a TCC tied to TCC funding. So with that being said, I have to be very clear on where our exclusions and prohibitions are. So our TCC is strictly prohibited from participating in what is considered lobbying and or political advocacy activities. So some key examples of some of these activities would be grassroots lobbying. Let's say, for example, letter writing campaigns to reach out to a local policymaker or shaper about a specific issue or specific legislation. That is an excluded activity. We cannot support that with TCC funds. Direct lobbying by grantees. So direct lobbying to congressmen and other elected officials about specific issues and trying to sway their, how do you call it, how they will vote on a particular issue. That is outside of the scope of TCC. Where we occupy is generating the information, translating it, and then providing it in a number of different ways. The direct influence is not a part of our scope of work. Another example is influencing certain federal contracting and financial transactions, and the list goes on. I strongly encourage all of you that are interested in competing in the Shark Tank competition to take a look at our lobbying guidance, which is at the link below. I want to bring attention to the diversity of our pilot project. So we currently have 10 funded grantees. We have 7 grantees that are under final review. And our goal for this, this particular cohort of grantees under which Shark Tank is occupied, we're looking to identify and move forward with an additional 5 to 7 grantees for our year 5 cohort, which will go from August 1st, 2016 to July 31st, 2017. This will be our last cohort of pilot project grantees for this particular TCC cycle. I want to bring your attention to the the graphic just to kind of give you an interpretation of the diversity of the pilot project program. So we definitely utilize the pilot project program mechanism to expand beyond our 4 core policy areas. You'll see we have one project that's devoted to disparities in kidney transplantation. We're looking at healthy eating and exercise on college campuses. We have some focused work, so we have something that's within the auspices of the meaningful use of health information technology, but one of the pilot projects is focusing on a particular vulnerable population, which are the transgender population. So again, you get a sense of the overlap with our core policy areas, and then looking at specific populations that we may not be touching within our core policy areas, or just new policy topics altogether. If you want more information on our pilot project program, we do have our pilot project website active. We do have to make a number of key revisions to that website, but there is some definite salient information there. We definitely encourage you to take a look at that, especially if you are successful in completing a concept paper and you want to know more about kind of what next steps are. Definitely go to that website to be informed. Okay. We're going to talk a bit about the Shark Tank competition. So the purpose of this Shark Tank competition is to employ a new approach to identify collaborative partners that we can work with within our pilot project program. So we have a traditional request for applications process or request for application cycle, RFA. We want to diversify our mechanisms to identify different partners, and so this Shark Tank idea actually was birthed here on campus within our Office of Sponsored Programs. We saw that it was a very great mechanism. We thought it held promise for our TCC, so we are moving forward with giving it a shot. Another key goal of this Shark Tank is to explore alternative approaches to partnership development and funding allocation. There are a number of different ways that you can go from developing a policy research project idea to submitting a full proposal for review and approval. So we're really trying to think about different ways to get from A to B, and Shark Tank is a different direction for us. So who is eligible for the Shark Tank competition? So it's open to academic and non-academic investigators. As we said earlier, you must operate within states within HHS Region 4 or the CDC Red Eye member states, which are listed. All applicants must report a DUNS number and be eligible to accept federal funds. This is a requirement of our funding agency. We are not allowed to work with any institution that is not officially recognized by the federal government and is not in good financial status with the federal government. For our academic investigators, the requirement is you must have a full-time faculty appointment at the instructor level or higher. If you are an adjunct faculty or if you are an academic faculty that does not have a faculty appointment, you are not eligible. However, if you can demonstrate support from a department chair or institute center chair, that is something that we will take under consideration as far as eligibility. Another requirement for all academic investigators, you must identify one non-academic collaborative partner. For our non-academic investigators, we are open to applicants. We're open to candidates from community-based organizations, faith-based organizations, health services organizations, and the like. We do ask that if you are applying that you do meet the requirement with the DUNS number. And for our non-academic investigators, you must identify at least one academic or research collaborative partner that's working directly with you on your project. And all applicants must register to attend our TCC Health Policy Research Summit in order to participate in the Shark Tank. So who is not eligible? Our current pilot project grantees, you are already in the pilot project program, so you are not eligible to apply for Shark Tank. Prospective pilot project grantees with applications that are under final review. We already have you in our system. You're already your application or your idea is already being vetted, so we don't need an additional idea from you at this time. All pilot project applicants that have applications that are currently under our internal review within the TCC. So if you successfully submitted an application for review in our last RFA cycle, which I believe ended in February of February 1st, I think it was. February 1st is when that deadline was. So if you submitted an application there, your application is under internal review, so we're asking you not to apply for Shark Tank. TCC research project investigators may not serve as PIs for a pilot project. However, they are eligible to serve as collaborators. Entities that are unable to accept federal funds may not participate in Shark Tank. And lastly, students, fellows, and other academic personnel that do not have a faculty capacity, unfortunately, are not eligible to participate in Shark Tank. The reason why is that the Shark Tank and the pilot project program is specifically focused on developing researchers. So if you don't have a research orientation that's tied to your job description or tied to your role within your institution, the likelihood that you would have the time and support to develop in a research capacity is questionable. And that's just really not appropriate for our goals here with our pilot project program. We're going to talk a bit about the Shark Tank concept paper. Before I go ahead and move on, I just want to do a quick scan, make sure everybody is still there and can still hear us. So go ahead and hit us up on the chat line if you're still with us. Okay, wonderful. Thank you. So the concept paper. What is a concept paper? There are a lot of different names. They've been referred to as prospectuses, preliminary proposals, or pre-proposal. Essentially, a concept paper is a well fleshed out summary of your research idea or research project, my apologies. It helps to clarify and organize your ideas in a written form and provides the basis for what your full proposal or your full solicitation will be. It's really helpful in saving time and effort for both the agency that's providing the funds as well as the person that's writing the proposal. In the event that the idea is just off the mark, you don't go through the trouble of having to develop an entire application, which many of you know is very time consuming. Concept paper is typically 2 to 4 pages in length. What we're asking for our Shark Tank is a 2-page, a very tight 2-page maximum concept paper. The typical topic areas are the idea, the need for a project, and how you're going to implement the project, and a budget. And I bring specific attention to the concept paper being clear and concise to best communicate the project idea. So it's really about getting to the point and really sharing with a potential reviewer what it is that you're trying to do and your plan to get it done. And concept papers are typically non-binding, meaning that once you submit the concept paper and you've received feedback, more than likely some revisions are necessary before you have your full proposal idea. So for our Shark Tank concept papers, what we're looking for is a project title, names and titles of the principal investigator or PI, and all other investigators and collaborators that will be associated with that with that concept paper. We are asking for a project abstract, 250 words or less, a brief organizational description as well, and then the actual meat or the content of the concept paper. We're asking for 2 pages maximum. I have them here bullet pointed, but definitely refer to the frequently asked questions as well as the call for concept papers for more information on what we're looking for these specific subheadings for your concept paper. In a nutshell, we're looking for you to delineate the health concern or the disparity or the population that your proposed project will address. We're asking you to articulate your central research question, which is, what are you examining? These specific aims are the activities or what you plan to do to answer the research question. The most important part of the concept paper, which should take a lion's share of the space, is your research plan. So being very deliberate in identifying who you will be reaching out to or what systems you'll be reaching out to and how you will recruit or engage them. Data collection methods, or how you're going to be generating information or data. what your primary outcome measures are. So the primary things that you're going to measure to determine whether or not your program or your research has been successful or has an impact. As well as your data analysis. Once you acquire this information, how are you going to systematically review or analyze it to be able to present findings? So all of those different aspects are very important for you to think through and present in your concept paper. Anticipated deliverables or products. So if there are any specific products such as policy briefs, presentations, and even scholarly work that you anticipate coming from your research project, briefly mention that in your concept paper. The last two items, why your organization is uniquely qualified for this opportunity. Here you can be relatively brief because you are providing an organizational description as part of the larger application, but we want to know specifically why you. Why is your organization tied to, aligned with the TCC focus, and why your organization is uniquely qualified to carry out your proposed project. And then the anticipated policy impact. And what you can do is definitely use the McKinley model that we've provided you earlier, kind of as a guide to articulating what you mean by policy impact. And then there will be an abbreviated budget that we are asking for. We'll be updating the website with some budget information, and I'll share a few items with you right now. So the total budget may not exceed $50,000. You are not held to asking for $50,000. We want you to be mindful of what you feel is a feasible amount of funding to carry out your research project. So if you're proposing $25,000 project, ask for $25,000. If you're proposing more of a developmental type of project that doesn't necessarily require a lot of heavy research, ask for $10,000 or whatever you feel is necessary to carry out your scope of your project, but do not exceed $50,000. Just a quick description of some of the allowable expenses, which are typical of many NIH grants. We do cover personnel costs and fringe benefits up to a certain extent, consultant and contractor costs. Durable equipment over the amount of $5,000 will require our approval. Supplies, travel that is necessary to complete the scope of work for your project, other expenses, and indirect costs or F&A. So you must have a negotiated rate agreement if you are asking for indirect costs in excess of 10%. So some of the unallowable expenses are delineated in the Shark Tank FAQ, and if you want an exhaustive list of unallowable expenses, by all means you can review the NIH grant policy statement that is provided in the link below. So concept paper submission details. So in terms of page limits and formatting, we're looking for 2 pages maximum, single space, minimum 11-point font, 0.5 margins. Please, please, please make sure that you submit all of your items using the Shark Tank submission form. You can get to that form through our TCC Summit webpage at msm.edu/TCC Summit. The deadline to submit the concept papers is Monday, April 11, 2016. Given this relatively tight timeline, we will not be honoring any extensions. What I will say is if you have any challenges with the submission form or if anything out of the ordinary should transpire, please by all means reach out to us using our tcc@msm.edu email address or contact our key contact who is Dr. Divino Fabu. And her contact information you can find at the end of these slides. We anticipate releasing the decision letters by Friday, April 15, 2016, and we're asking for a response to the invitations for those that we have selected by Tuesday, April 19, 2016. A few notes about the actual competition. So we will be selecting up to 5 candidates to participate in the Shark Tank competition that will occur at our TCC Health Policy Research Summit on Thursday, April 28, 2016. The competition will occur during our opening session, which is from 8:30 to 10:45 a.m. The format will be each candidate will be introduced and they will deliver a 5-minute pitch describing their project. We do allow the use of audio visuals such as PowerPoint and other visual aids. We ask that you let us know what you plan to use before you arrive with those materials, and we'll make arrangements to have them either shipped here or have them available upon your arrival. Our Shark Tank judges, they are actually members of our TCC Pilot Project Scientific Review team. After you've delivered your pitch as a candidate, if you are selected, they will have up to 10 minutes to communicate with you to discuss some of the merits of your project and some questions that they may have. The Shark Tank winners will be announced during the closing session of our summit, which will occur from 4:30 to 5 p.m. EST. So after the Shark Tank, prospective grantees, you will be responsible for submitting a full pilot project proposal in order to obtain the funding. Again, I'll make a note of funding being contingent on the favorable review and approval of our internal team as well as our funding agency. We cannot make any kind of commitments on funding until all applications and supporting documentation has been vetted by our funding agency. However, what we will do and what we do want to bring to your attention is that you are not alone in that process. Grantees will receive support and guidance from our pilot project team towards the development of your application. It is a pretty quick turnaround time, so we want to definitely facilitate that process as much as possible and make it as seamless as possible. I can't say it'll be easy, but we definitely can iron out some of the potential pitfalls and delays. We anticipate being able to submit all full applications to NIMHD for final review at the end of May. So what that means is we're looking at a window of around 4 to 5 weeks to turn around your concept paper into a full pilot project proposal. As I said earlier, the funding is contingent on favorable review and approval by our agency. And in terms of the anticipated start date of all projects that have been approved by our funding agency is August 4th, 2016. And all projects have a duration of 12 months. And we're really looking to start on time and end on time with this particular cohort. Just for your review, and again, these slides will be posted after the end of this webinar. Just a timeline of key dates and deliverables for the Shark Tank opportunity. And I will end with a few tips on writing a competitive concept paper. First thing, avoid starting from scratch. Given the nature of this Shark Tank opportunity, it really is a rapid response opportunity. So ideally, you would have a project idea that has been sufficiently vetted or sufficiently fleshed out to a certain extent to move forward with this opportunity. Unless you work very fast, I would recommend that you not start from scratch. As you are preparing your concept paper, and especially as you are, if you are selected for the competition, you want to make the assumption that we are not the experts. So consider yourself the expert on your project and on your proposed idea, and write your concept paper to kind of walk us through your thought process and your development process. I think that's vitally important. Whenever possible, cite peer-reviewed literature and respected data sources to substantiate key points. You want to ensure that your research project is positioned to inform health policy and practice in a meaningful way. What we mean by that is proposing an intervention and then suggesting that it has policy implications is really not enough. What we're really looking to do with all of the work within our TCC is to set ourselves up for a deliberate policy impact. So really help us connect the dots as to how your project is going to create a policy impact, whether directly or indirectly. You want to ensure that your project is feasible in terms of time and budget. And please be realistic in your study design and your anticipated deliverables. One big pitfall and one big challenge that some of our former applicants have had is they've been very ambitious with their projects and very ambitious in what they wanted to accomplish with the budget. I want you to understand that the members of our pilot project scientific review team, you know, many of them are very well seasoned in research, and we understand the reality of research. We understand the reality of programming, and so we want you to be realistic. You will not be you won't be dinged, if you will, for not having a super robust or overly ambitious project. We want you to be feasible. When you're preparing your budget, we want you to calculate your indirect cost or F&A into your total budget, and that max again is $50,000. And we want you to focus your attention on describing your proposed project. Another major pitfall that that we've seen in some of our applications is the focus may be on describing the organization or describing the problem or describing, the background. We really want you to focus your attention on what it is that you plan to do and how you plan on doing it. Just to echo a few additional pitfalls, you want to definitely ensure that your research plan is not vague or is lacking scientific rigor. So again, follow the steps that we provided. Make sure that you describe your participants and how you're going to recruit them, or the organizations if it has an organizational focus, your outcomes of interest, your research activities, your data collection, and your data analysis. What I'll say with this is that we're not looking to have everything fully fleshed out, but we do need to have an idea of what direction you're going across these different areas. If we don't have that information, we have to assume that you haven't thought through that, and that's going to be something that may not work in your favor. If you propose lobbying or direct advocacy activities that are prohibited with our TCC funding, that can be an area of concern as well. If your timeline is too ambitious, remember that the program is 12 months. If your budget is unclear or unjustified, what we're asking for is for an abbreviated budget, but you do have to provide some type of justification for what you're asking for. What we'll do is moving forward, we'll work with you, those that actually win the competition, to make sure that your budget is up to standards before we officially submit it. But we do need to get an idea of where you want to spend the money. And you also want to avoid very vague, diffuse, broad, or underdeveloped writing. Be specific. As much as you can, be specific. And that is the end of our presentation. I know that I went through quite a bit. I think I took about 40 minutes, so I didn't quite make 30. But we wanted to provide you an overview of what we're doing collectively and to walk you through the steps of our Shark Tank competition. So at this time, I am going to turn it over to Dr. Ofebu, and we will take question and answers, or take questions.
And I see we still have a few of you guys with us. So do we have any questions?
Hi, Dr. Devine. This is Andre. How you doing today?
I'm good. How are you?
Good. It was a great presentation, a lot of information. I really appreciate you guys taking the time to get us informed. Can you send me this PowerPoint presentation so I can reference it as I'm getting my my papers together and everything?
Yes, I just sent it 15 minutes ago, so it should be in your inbox very soon.
Okay. All right. Thanks.
You're welcome. Do we have any other questions?
I really don't have any other questions up front.
Okay.
Like I said, you guys did a good job of really laying out the expectations, and basically we just got to follow those guidelines. I think we'll be fine.
Okay. And please reach out if you have any questions. Just like Jamie said, we're here to help and to make the process move a little faster, especially with the turnaround time of April the 28th.
Okay, I absolutely will.
Okay. Anyone else? No, I've been checking out. Anyone else with any questions? For the most part, I just wanted the presentation.
This is Dr. Hopkins. I just want to definitely say thank you so much for joining us here on the webinar. This webinar happened very quickly. We will do the best that we can to immediately post this information onto our website. What I will ask is, because the opportunity has only been circulating for a number of time, please definitely share the opportunity to other colleagues are aligned,
I'm not sure if that was Jamie talking or not, but I could barely hear hear him speaking. I don't know if anybody else had that problem.
Oh,
Okay.
my apologies. I think I was a little bit away from the mic. I was just saying that it's really important for us to disseminate this opportunity as far and wide as possible. So we definitely encourage you to reach out to other partners that you think may be a good fit for the Shark Tank competition or the pilot project program. We will continue to disseminate the announcement, and then we will move forward from there. And I think that's everything I have at this point. We're going to go ahead and also just going to say, again, thank you for joining us. And just open it up if there are any more questions. We'd be more than happy to answer them for you.
Okay. So thank you guys again for participating in the webinar. We look forward to hearing from you guys throughout. So please look forward to communicating.
Thank you very
Okay.
much. This is Cindy
Thank
Griffin
you.
signing off.
Okay.
Thank you very much.
You're welcome.
Bye.
Okay. Bye.
Take care.
Okay.
Oh, wow. Nice question.
Yeah. A few of these I've been going back and forth with. Well, most everybody that's on here, I've been going back and forth with about everything. So they might be just, they're going to hold audio. Oh, we have to hit stop recording.
Oh, okay.